Hi everyone, this is a video about the proposed rules and regulations for supplements in Canada. Over the last several weeks, you may have heard some things about different rules and regulations that have been proposed for supplements in Canada that might impact our access to those supplements and prices for supplements and this and that. So I wanted to post this video to share my interpretation of what's going on and just also want to create this video for folks who follow me on social media and for my patients to give some direction if there's something that you want to do about this issue. If you want to voice your opinion about it to the government, then I'll share my opinion on how you can do that. I've been following this issue quite closely. I've been looking at the information from the CHFA, which is the Canadian Health Food Association. If you've seen any of their campaign materials, it's their kind of tagline has been SOS or Save Our Supplements. There's also another group, I can't remember the exact acronym now, it's something like the NHPA. I've looked at their material they've put out. The Canadian Association of Naturopathic Doctors, which is our national naturopathic association in Canada, they've also been putting out information, sending that out to all the NDs, including myself. And so I've been, and I've also been, actually read the long, boring, legalese kind of language from the Health Canada website about the actual proposals and whatnot. So I've been steeping in this as much as I can, getting information and opinions from as many sources as I can to try to formulate my own opinion. So that's where what I'm about to say is coming from. This is all just my interpretation of things. So to my understanding, there are actually two kind of separate issues. They kind of overlap in that they both have to do with supplements slash natural health products or NHPs, but they are actually two distinct issues to my understanding. So one is the content in Bill C-47, the annual budget bill that came out, and there was a section in there which, to my understanding, was saying they want natural health products like herbs, supplements, homeopathics, things like that to all be included or under the same rules as something called Vanessa's Law. To my understanding, Vanessa's Law is a law that's been in place for quite some time, which basically applies to pharmaceutical drugs and I believe to medical devices as well, where if there are adverse effects, side effects, things like that, or issues with those pharmaceuticals or medical devices, they have to be reported. That makes sense. And so in Bill C-47, my understanding is that they're saying that the same rules are going to apply to natural health products. On the one hand, I really haven't seen any or heard of any reason why we should be opposed to that. Generally speaking, more accountability and reporting of side effects makes a lot of sense, and there doesn't seem to be any that I've heard any obvious negative impact that would have on consumers, clinicians, etc. I don't think that it's going to directly affect anything at the level of, I'm going to the store to buy the supplements that I want to buy. I don't believe it's going to have any direct impact, to my understanding. On the flip side, I also am not aware of there being any major reason to include natural health products under Vanessa's Law. If it's just for ideological reasons, that's fine. I mean, on paper, makes sense. Why not do that? However, I'm not aware of any, string of major adverse effects, deaths, maimings, anything like that related to natural health products. I've looked and haven't found any references or citations to that, so I'm not really sure what the rationale is, but again, there doesn't really seem to be any reason to push back against that, so to speak, for lack of a better way of putting it. So that's kind of issue or matter one. And to my understanding, none of the provincial naturopathic associations, the National Naturopathic Association, the CHFA, seems like the majority of stakeholders are not voicing any concerns about that part of the issue. This Bill C-47, not worried about it. There are some groups that are concerned about it, but I don't believe the majority are, and I'm where the dust is settled, I don't see any major reason to be concerned about it. The other matter at hand is what Health Canada put out in May of this year, and it's entitled something to the effect of proposed fees for natural health products. And so to my understanding, that is essentially a cost recovery plan where essentially Health Canada expends a fair bit of financial resources to regulate natural health products. So rules around labeling, costs that they incur to review new products that are being brought to market. I'd imagine there's inspection fees and things like that. Fees around customs for looking at different natural products that are being imported into the country. And so to my understanding, Health Canada is proposing this fee recovery system because they're saying, well, we're spending all this money so that the supplement companies can sell supplements, and that they can regulate them, so they want to recover some of that cost. At face value, at first blush, like, well, that makes sense. But what's of concern to me, and to my understanding, of concern to a majority, if not all of the stakeholders in this, is and stakeholders would also include the public, because we use supplements. I'm a naturopathic doctor, but I'm also a supplement consumer as well. So wearing both of those hats, my understanding is that those cost recovery measures could have some significant negative impacts. So one of the negative impacts that could potentially arise, and in my opinion, I would say likely arise, is that we will see an increase in the cost of supplements. Goodness knows the supplements are already expensive enough as they are, but of course, if a supplement company is going to have to pay more or pay for these new annual fees, well, of course, they're going to recoup those expenses by increasing the cost of their supplements. So we're going to be paying more at the counter, so to speak, at the retail outlets where we're buying these things. The other concern is that these increased costs could very well put a number of small supplement companies out of business. Having looked at the proposed costs and the annual costs for supplement companies under this proposed system, the costs could be up to around $100,000 every year for these companies. Now, it depends on what they're actually manufacturing, and I'm a little bit rusty on the exact numbers. I think it could be as low, I'll say in quotes, because it's still quite a lot, could be as low as maybe around $30,000 to $40,000 a year, but depending on how fancy their operation is, or they compounding sterile products, etc., it could be upwards of around $100,000 or so per year. There's actually more small supplement companies out there than you might think there are. We've all heard of some of the big names out there, many of which have been bought up by large corporations. However, there are a bunch of small supplement companies across Canada, and to my understanding, a number of them would not be able to weather those increased fees. So we may lose just outright some entire supplement lines, and that would not be a good thing. And I also think it's also not a good thing to lose small businesses, because quite frankly, small businesses are the backbone of our economy and are really important for lots of reasons. That's maybe a separate issue. So the third issue that could arise, and I think could very likely arise from this, is that we may also see a reduction in the number of new products that are being brought to the Canadian market, because as part of these proposed fees, there is also there are also fees for approving new applications for new products, and those new products, again, depending on how fancy and complicated they are, it could be anywhere from around $1,000 per product that's proposed to $23,000 per product, if memory serves. So if a new supplement company wants to start up, it's like, hey, we've got 100 products, and let's say they all only cost $1,000 for each one to be approved. It's like, wow, that's quite an increased startup cost, and so that company might say, I'm not going to start up a company in Canada, I'll start up somewhere else where they don't have these recovery fees. So to summarize those last 3 points, the three main reasons why this could have a negative impact on you, the consumer, directly here in Canada, is we would likely see an increase in the cost of supplements at the checkout. We may see an entire loss, or a loss of entire supplement lines, and then we may also see reduced availability of new supplements coming in, because companies are just not going to want to pay for the privilege of selling them here to Canadian citizens. So if these are issues that are of concern to you, there are some steps that you could take moving forward. One step is that you could consider sending a letter to your MP about this matter. The Canadian Association of Naturopathic Doctors put together a good template letter that kind of covers everything that I just said in essence. And if you'd like to access that letter, you could talk to your naturopathic doctor, or your Canadian naturopathic doctor. They should have access to that, because this template letter was sent out to all of the members of the Canadian Association of Naturopathic Doctors, which is a majority of Canadian naturopathic doctors. So you could talk to your naturopathic doctor about that. Or if you'd like to access it in a more direct way, if you sign up for my newsletter, then I've modified my newsletter so that there's a little download link in there. So you can sign up for my newsletter, download it, then unsubscribe if you want. It was the easiest way that I could figure to kind of automate getting it into folks' hands. So if you're, depending on where you're watching this video, the link to join my newsletter may be in the description below, or if you're watching this on Instagram, then if you click on my bio, then there's a link to my link tree, and you can there's a link there to sign up for my mailing list, so you can access that. Also in the newsletter, there is a link where you can find your MP by postal code. So if you can't remember who the heck did I vote for, or who the heck didn't I vote for in that last election, then there's a link there, so you can access that to contact your MP. Or fill out the template letter, tailor it to your liking if you're so inclined, modify it as much as you want, or write a letter from scratch, whatever you want to do. But then consider emailing that or snail mailing it to your MP to let them know that this is something that you have concerns about, and you'd like them to come up with a different plan, and that doesn't involve these potential negative outcomes. The other thing you could consider doing would be actually setting up an appointment to meet with your MP and talk to them in person. I don't think it would take a whole lot of time, but just voicing it and adding that personal touch of saying, like, hey, supplements are something that are important for me. They help to promote my health. They keep me healthy so I don't have to go into the hospital and potentially go to the hospital and use up, so to speak, more publicly funded healthcare dollars or whatnot. So kind of adding that personal touch that saying, hey, I'm one of your constituents, this is how this is going to impact me, and that of course could carry more weight than sending a letter, but a letter is great, meeting in person even better, and so again, contact information for the MPs, you can of course look it up through other mechanisms as well, but it's in the newsletter, or in the welcome letter, shall we say, for my newsletter. I think those are all the points that I wanted to cover. If anybody has any comments or questions about this, please feel free to post in the comment section below. If there are things around this issue where you're like, oh, I thought this, this or that was different, let me know. I'm just sharing the information that I have, trying to educate folks and give a good, reasonable options for how we can do something to, make a difference with this issue. If it's something where you think, yeah, I don't think this is the best set of steps for the government to be taking, let them know. They can figure out something else, and hopefully it won't have a negative impact on the healthcare industry and consumers, because we all benefit from being able to access these products. I know I do personally, my patients do every day. I think it's really important to try to let them know that this is something that we'd like to see a difference with. So if you have any comments or questions, post in the comment section below, and otherwise I will leave it there for now.